Thank you for the very kind info. To those of you that I've spoken with before, this is not my normal voice. I've lost it the last 2 days, so please bear with me. So I'm going to primarily talk about resiliency. As a cancer rehabilitation physician, normally we're mandated with managing fatigue during or after treatment, or helping people through neuropathy, or introducing an exercise regimen, or for those of you that may have developed lymphedema, finding strategies to cope with lymphedema, or things of that sort. But as I've been in this space over time, you begin to notice that with the challenges of all the medical care that you've heard about, that you kind of observe that some people are able to be more resilient in the face of this distress better than others. And you begin to ask why. Like, how is it that we can be going through similar, very challenging circumstances, and some people just cope better and seem to rise above these challenges maybe better than others? And I'm going to share some of those observations. And even on a personal level, sometimes I share, my nephew had, 3 years ago now, was diagnosed with leukemia at the age of 7. And I could tell you in the 70s or so, the survival rate was about 30%. And thanks to the great research that has occurred over the last number of decades, the survival rate is now over 90%. But it did require 2.5 years of chemotherapy for a 7-year-old who finished when he was 9.5. And it brings up issues of not just how does one cultivate resiliency as a 7, 8, 9-year-old, but there are parents, and for all of you in the room, there are family members and spouses and loved ones that are not the only ones undergoing the challenges that Dr. Hamid just alluded to, with anxieties, with waiting for the next scan and whatnot. So with that, I think before talking about what resiliency may entail, it's worth defining when we really need it, right? We don't need the skills of resiliency when life is rosy, but when there is some element of anguish or suffering. And psychologists may define suffering in different domains, and I just want to highlight this briefly. So one is, starting in the top left, preoccupation with the future or past, or a disconnection from either ourself or others or our environment, a need to be in control. And this, of course, can be a very common occurrence among many of us when we're waiting for the results of the next scan and we feel like we have no control over that, or a crisis of meaning that we'll talk about, so having what's called an existential vacuum. And so these are basically life questions. This is not a cancer issue necessarily, although cancer may bring up these very basic fundamental questions of what does it mean to be healthy when my medical chart says I have X diagnosis? And what does it mean to be whole? And again, the most fundamental question that I think is so important for rising above the day-to-day challenges of going through these medical challenges, what does it mean to be resilient? And even though, as a physician, and I'm not a psychiatrist, but as a physician, I use Xanax and Ativan and antidepressants to help people manage these challenges, I could tell you no drug is going to answer any of these questions. So if we're going to try to optimize having some sense of resiliency, we have to think about strategies that go beyond just Ativan or whatever the drug is of choice. So one strategy that I want to start with is thinking about one's sense of meaning or purpose. And I'll start this story with Mr. Israel Crystal. Some of you might recognize his image. He got quite a bit of attention a couple years ago because at the age of 112, he became the world's oldest man at the time. And for anyone to live 112, it's amazing, but he happened to get to this age as a Holocaust survivor. And so when he got this Guinness record, of course, he was in a flurry of interviews and appearances on shows, and I happened to read this one excerpt that stood out to me when everyone was asking him, how did you get to 112 despite having gone through all the horrors of the Holocaust? And this is what he said: "I don't know the secret for long life. I believe that everything is determined from above and we shall never know the reasons why. There have been stronger, smarter, and better-looking men than me who are no longer alive. All that is left for us to do is to keep on working as hard as we can and rebuild what is lost. And the reason this stood out to me, this one passage out of a larger interview, was that last phrase where he alluded to the idea that all that is left for us to do is to keep on working as hard as we can and rebuild what is lost. And I think what he was really speaking to, I imagine, and there's no way for me to know for sure, is what gave him a sense of meaning and purpose in his life. That may have been a critical piece to his remarkable resiliency. And amazingly, there really has been some research in the psychological literature that has demonstrated this. And this is from a study that came out just a year or two ago where they analyzed 10 smaller studies that looked at over 100,000 individuals. And they basically found that even when you control for who was obese and who had different cancers and if you had diabetes or if you're a smoker or non-smoker, when you took all those known variables, but you compared people who had the strongest sense of meaning and purpose in their life compared to those who had the least amount of meaning and purpose, there was a survival difference. There was about a 17% improvement in survival for those that had the strongest sense of purpose. And even though this study came out recently in 2016, this is something that Viktor Frankl wrote about over 70 years ago. And if you've never read or heard of his work, he wrote a famous book called Man's Search for Meaning that I would highly recommend to everyone if you've never come across that book. But before getting to what he wrote about, it's important to understand who Viktor Frankl was. And without recounting all the horrors of the Holocaust, he was a young psychiatrist that was absorbed into the concentration camps. And during that time that he was in a concentration camp, as a young psychiatrist, he lost virtually everyone that was important to him. His pregnant wife perished, his parents, his brother, all died. And you could imagine, and I'm not here to recount all the horrors of hunger and illnesses and losing personal belongings, et cetera, et cetera. And so he went through all that, and he had some important observations. And one of his observations was looking at the people who survived. And he wrote about this. He said, it didn't seem to him that it was the strongest physical individuals that survived. And just anecdotally, he noticed maybe 1 in 10 survived, and what they seemed to have in common was beyond the luck. I mean, there was some luck in terms of whether you went to this line or that line. But what he noticed is that the 1 in 10 who survived, again, had some profound sense of meaning and purpose in their suffering. So they needed to rise above this occasion because they wanted to go and write the book about what happened, or they want to go back to their art or their science or their family or whatever was, again, important to that individual. And so Frankl argued in this famous book, and there's a form of therapy called logotherapy that utilizes this approach, that there are fundamental ways that one can find a sense of meaning and purpose, and it either involves something through your work or through cultivating some sense of courage, particularly through difficult times, and through acts of compassion and love, which is involving, obviously, connecting and caring about another person. Again, he wrote this book after World War II. I think he finally published it in 1950 or 1952. More recently, there's been, to me, I may be biased in this, just amazing literature and science looking at the underpinnings of this kind of biology. And I'll introduce this next study with this idea. So there's been some research comparing those who may have a hedonistic or eudaimonic personality. And of course, I think we all know what a hedonist generally is. And I think most of us will answer that a hedonist is someone who basically is a pleasure seeker, right? So if I'm at a big party and the person sitting to my left on the dinner table is a hedonist, he may be there because he wanted the filet mignon, or he loved the lights, and everyone's dressed nice, and there was nice champagne, and so that's what drew him to this event. Now, if the person to my right was a eudaimonic personality, I think probably most of us are less familiar with this term. A eudaimonic trait is one where somebody is generally community-oriented or more altruistic. So they're more interested in being of service in some way. And so if the person to my right is a eudaimonic type personality, he may be there because the event is a fundraiser for something important that they're passionate about, or he may be there because they want to have some meaningful conversations with an old friend, or something of that kind. So the reality is, if you think about it, most of us have some hedonistic traits and some eudaimonic traits. But like all things in biology and in human nature, there are extremes. So there could be some people who are very strongly hedonistic and some who are very strongly eudaimonic. And this one group from UCLA, Steve Cole and his colleagues, analyzed the blood of these two groups. And they didn't just pick people who happened to be hedonistic, eudaimonic. They specifically chose individuals who were happy. So they were hedonistic and happy or eudaimonic and happy. And they looked at their blood. And this was what I thought was interesting in what they found. So one, we've heard a lot about genes. The genes associated with adversity, which is kind of related to distress, were turned on among the hedonistic group and turned down among the eudaimonic group. And these inflammatory compounds that we often hear about how inflammation is associated, for example, with heart disease and certain cancers like breast cancer and colon cancer. It was actually higher in the hedonistic group and lower in the eudaimonic group, and antibodies, which we know is critical for our immune system, again, was lower in the hedonistic group and higher in the eudaimonic group. I have no idea how this translates to melanoma or cancer in general, but if we believe that our immune function is critical in managing this on some level, then it really gets us to wonder how we're living our life and the way that we're connecting to the world and how that may have implications for our health in general. And again, if you think about it, this is what Frankl predicted 70 years ago, right? He said that those people who were kind of had some meaning and purpose, which is another component of being eudaimonic, they seemed to survive better. And I could only imagine how he would have felt if he were alive today to see this research. So let's transitioning to another element of resiliency and the patients I've seen who seem to really do well just seem to have a gift for mastering perspective. And this doesn't mean, and I hate it, and I imagine many of you do as well. So many of us, we often hear, just think positive, right? Everything's going to be great, which is stupid, right? I mean, that's the last thing you want to hear when you're actually walking through these challenges is just thinking positive. So it's not just viewing the world through so-called rose-tinted glasses. But that said, there is something to be said for having some sense of balance when it comes to perspective. And if I just flash this image to you and asked you what's the first thing that you see, what would that be? So most people would say, and I'm hearing it, to a couple individuals. But then if you looked harder, you might see, there's a couple people inside. You might notice the ear is another woman sitting out in the corner. This could be, or it could be a light. So if we're forced to kind of just look at a situation, we may have an immediate reaction, but it's possible to change our perspective in some way. And it doesn't mean, again, that we have to view everything as being perfect, but we have an opportunity to still have some sense of balance. And again, Viktor Frankl wrote about this. So he wrote about the space between. So he said between stimulus, so that means what something happens to us. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response, lies our growth and our freedom. And what he really argued and talked about at length was what he refers to as the last of the human freedoms. So what he said is the Nazis could have taken all my personal belongings and my food and my home, but he said they can never take away my ability to choose how I'm going to react in this situation. And that's something that every one of us in this room still own, is the control. And it may not be easy. Again, Frankl agreed that not every person, at least initially, can do this, but it is something we still have some capacity over. So mindfulness may be another strategy, and unless you've been living under a rock, you all have heard of this idea. But even though we've all heard the term mindfulness and what it may represent, the reality is it's still a challenge to practice this on some level. I mean, most of us would probably agree that as a culture, we've developed some ADHD-type symptoms in being able to sit and focus and be present on the present moment. And even though we don't have time to talk about it today, there's been an extraordinary amount of research on the role of mindfulness interventions for cancer patients and survivors, because all the strategies that I have talked about and the next couple that I will are really impossible to practice if we don't have some moments of mindfulness where we could be really present-centered. And there are programs called mindfulness-based stress reduction that are available at Cedars, at UCLA, through an organization called Inside LA. There are apps for this kind of thing now, and it may be a useful part of the resiliency formula. So creating a legacy, and I can imagine when we first hear this word, and if I asked you, what do you think about when somebody says the word legacy? I know I initially first think of wills, or who's going to inherit the China set, or what's going to be written on my tombstone, or something like that. And I think it's worth redefining the connotations of what it means to create a legacy. And so I'll start with this analogy, and it's right here. So I'll ask you this. Where do you think it's better to plant a young tree? A clearing in an old-growth forest or an open field? What do you all think? So we kind of feel about it. I first thought it was an open field because you get to hog up everything, right? You get all the nutrients for yourself. You get all the sun for yourself. It turns out it was the wrong answer. Ecologists will actually tell you that it's better to plant a young tree in an old-growth forest. And the reason they'll give you is that they'll say that the roots of the younger tree will develop these interconnections between the roots of the older, more established trees. Healthier trees can help support the weaker trees. And so there's this interdependence that develops that seems to be providing a symbiotic relationship for the whole forest. And I hope the analogy then is clear that when we think about the idea of legacy, it's not just thinking about ourselves, but what we're leaving in our world in general, and people who study legacy. And there is a whole psychological literature in the legacy arena will actually argue that legacy is not about the will or the trust or who gets the dishes or what's on our tombstone, but ultimately about life and living. And if we think about an analogy, so the first thing that usually comes to my mind is just thinking about, let's say, US politics and a president. So when a president comes into office, do they think about their legacy at year 7.5 when they're on their way out? Or probably day one, right? They're probably thinking about what kind of legacy they're going to leave in the US history books from the time they start. And so that is the argument with legacy, that if we have a sense of this, we're going to make every day count because we're really thinking about not just the implications for ourselves today, but how it's going to impact our family members and others. And so even though initially it may remind us about death, it really ultimately, the argument goes, reminds us about what's most important to us. Because if you have a sense of legacy, the argument goes that you're not going to just be thinking about who's doing the dishes today or just kind of day-to-day nuisances, but we're really thinking about the things that mean the most to us. And there's been research in our literature that like the sense of legacy helps us decide the kind of life we want to live in, the kind of world we want to live in, and it's another way of being really present-centered because we have a clearer idea of these values. Cultivating gratitude. So there's been an incredible research body looking at the health benefits of gratitude, and for the sake of time, I'm going to go through this fairly quickly, but as you can see, it allows one to be present-centered. So, and you can imagine, when you're in a grateful moment, it's hard to think about the next scan or what's happening tomorrow. You're really there. You're less likely to be, or it's really impossible to be anxious or sad in that moment, at least, when you're experiencing gratitude. We sleep better, associated with stronger immune systems. We're more likely to empathize, strengthen social ties. And the primary reason I'm bringing it up here is that people who are grateful more often, it turns out that they're more resilient to stressors and distress. Now, when I first started to study this idea, I thought that's great, but I think I and maybe many of you may assume that we'll wait for life to be perfect and then we'll experience the grateful moment, or we'll wait for the scan to be a good report and then we'll be grateful, or we'll wait until we're happy about something and then we'll experience the moment of gratitude. And again, the psychologists that have studied this would actually argue that it's the opposite. It's not about thinking that life is perfect. It's actually the reverse, that you're grateful, and we'll talk about in a moment how one can achieve this, and then the happiness may come, not the other way around, that it's not happiness that leads to gratitude, but gratitude that leads to happiness. And one of the amazing individuals who's really talked and written about this at length is a gentleman by David Steindl-Rast. He's still alive at 92 or 3, I believe, and he would argue the following, that gratitude is something that we experience when something's freely given to you. So you didn't earn it, you didn't kind of make it come about in any way, it was just given to you. And that's when you experience a moment of gratitude. And if that is true, he would go on and say that the one gift that we all get that was given to you, that you didn't earn or you didn't bring about in any way, is this moment. And so, and he would argue that this moment is an opportunity. And the opportunity, he would say, is usually to enjoy something. So if you're in the park, you could enjoy the park. If you're by a sunset, you could enjoy the sunset. If you're talking to someone, you could enjoy that conversation. And sometimes when there are challenging circumstances, like waiting for the next scan result, that the opportunity isn't to be grateful for the fact that I have melanoma, but to be grateful for the opportunity that you can rise above it in some way, or teach someone something, or fight for what you believe in, or do something that is an opportunity even though it's a challenging one. And so the challenge again is that, and he would argue the same, is that unless we're mindful about every moment that we're given, it's hard to experience gratitude. And as I wrap up, and we could spend a whole hour just talking about this and the importance of connectivity and humor, and I'll ask you another question. And by the way, the answer to this question is really based on pretty substantiated research. So I'm not just pulling this out from kind of University of Arkansas journals and whatnot, okay? So what human condition increases the risk of death as much as smoking cigarettes and more than physical inactivity or obesity? Any guesses? So we heard loss of hope, which may or may not. So a lot of people guess stress, and stress is complicated because actually stress can be very useful for some people and how we react to it, but that's a common guess. So the correct answer is actually chronic loneliness. And we know unequivocally that, and I didn't say we all feel lonely sometimes, so it's not the occasional feelings of loneliness that we all feel. It's the month after month, year after year feeling that's associated with a number of issues, including increase in heart disease. There's pretty strong associations with cancer progression, at least for ovarian and breast and colon cancer, but it's chronic loneliness. And we know that when we're lonely for long periods of time, it changes our stress response. And this is a challenge, I think, because for those of us in this room, going through this, for some of us may be a lonely experience, which underscores the importance of having some kind of support mechanism or support system or some way of connecting with people despite. And even as a culture, if you think about us as a society, just since 1980, the number of people living alone has tripled. And I just want to cite this one study, which is still kind of astounding to me. So there was a study where they basically asked Americans, how many people do you feel like you can really count on at a time of need? Not just people that you happen to have around you, but you can feel like you can really count on or confide in. And in 2005, the answer was that 1 in 4 Americans said 0. So 1 in 4 of us feel like there's nobody we can really count on in a time of need. And given the health implications of this is something that, and the reason I even bring this up is this is something that's, we could still change this. We still have the power to change the way we're kind of investing our time and how we're connecting with individuals. So you may have heard this catchy phrase, right? Where the attention goes, the emotion flows. And if you're lucky enough to have a sense of humor, great. If you're not one of those people, to surround ourselves with people who are able to reframe situations in a humorous light, this can be incredibly, incredibly powerful. And again, the research has substantiated this, where, and again, this is not a cancer study, but in terms of general health, there's been some research showing that if you're able to view the world and the day-to-day occurrences in some cognitive orientation that allows some humor to filter through, you're more likely to survive. So it's associated with improved survival for heart disease and infections in women and infections-related mortality in men. And so we could spend hours talking about this. We do have a 6-week kind of resiliency training program at Cedars that we I know I kind of flew through this very, very quickly. It's only open to women with metastatic cancer at this time, but if you happen to be interested, feel free to contact me. But if I could just put a plug in for a couple of these ideas that are achievable. These are things that we still have within our domain of control, which are to think about what gives us a sense of meaning and purpose in our life, trying to really master our perspective. And again, this is the essence of cognitive behavioral therapy. This is what psychologists can offer, how we see a situation, how we could reinterpret what's happening. Trying to have some sense of gratitude without being, I would say, stupid enough to think that we should feel grateful for cancer. I would never say that, but there are still things that one can feel grateful for despite going through a medical diagnosis. Trying to integrate a sense of legacy into our lives. And it doesn't have to be mindfulness meditation, but some way that we can try to achieve a sense of being present-centered. And trying to maintain a sense of humor. That seems to always help. Thank you very much.